Hello there. My name is Joan Heal, and I'm a certified reflexology therapist. So I just wanted to put this presentation together just to explain the difference between a reflexology lymph drainage or RLD treatment and a traditional reflexology treatment. Why you would choose RLD over a traditional session, and just what is lymph and why is it important to your body. So before we get into the technique of reflexology lymph drainage, I thought I should explain to you exactly what is lymph. Well, lymph is the sewer system of your body. It removes debris, bacteria, viruses, and any other foreign substances that keep your body free of invading organisms and therefore free of infection. So your lymph system has no pump, so it requires movement to move the lymph fluid in your body. And your lymph system runs opposite to your blood system. So then, what is RLD? Well, RLD is a specialized reflex protocol. This technique was originally created to aid secondary lymphedema in breast cancer survivors. And it is a unique sequence of stimulating different pressure points on the lymph reflexes on the feet. So this technique was created by the amazing Sally Kay. She created this protocol by using her expertise as a nurse and a reflexology therapist while working in a breast cancer clinic in the UK. Sally applied her knowledge of anatomy and reflexology points on the feet that would aid in draining the lymph from the body. Sally is also an author and has won awards all over the world from the creation of this technique and her contribution to the wellness of so many people. So when Sally made her first trip to Canada, I was right there to get the training, and it is a wonderful reflexology protocol that you can often see or feel the results right away. And as more and more people are working with this protocol, the use of this technique has expanded to relieve symptoms from other autoimmune type of illnesses other than secondary lymphedema. So I was so lucky to have been trained and certified by her using this technique. So using RLD, you get some amazing results. So here are a few examples of before and after. So the first is someone that has lymph pooling in their hand. It's quite painful and really restricts the movement. The after picture is immediately after the treatment was complete. So you can see the difference. And then next on the other side, you see where pooling is just above the bra strap. And it's very uncomfortable and quite painful. Often people have to wear bigger size clothing to accommodate that extra pooling of lymph. And sometimes that pooling of fluid can be up to 500 milliliters, which is the equivalent of a small pop bottle. So you can imagine the painfulness of carrying that around all day long. There are also psychological effects, as this pooling is a constant reminder of the time that they had cancer, as they have to live with the consequences of secondary lymphedema, which has no cure. And having to explain why they have to wear a compression sleeve or why their arm or leg is much more swollen than the other causes pain or discomfort when discussing it with other people. So you can also already see the difference right away of some of the pooling that's moved out of the area right after the treatment. So another interesting thing is you may experience a cold sensation in your body during the treatment. And this has been linked to the lymph fluid being drained to other parts of your body for elimination. So research has been done with thermal imaging to capture this sensation. So in the top picture, you see the pooling of the lymph by the orange color in the hand. The middle picture shows about 20 minutes into the session, and you can see the lymph beginning to move up the arm. And then the bottom picture, you actually see the lymph has moved out of the arm and into the body for removal. Amazing stuff. So studies have proven that this technique has reduced the amount of fluid in the arms and feet substantially, and usually after the first treatment. In fact, the first treatment, you'll probably lose the most fluid. So how is this different from a regular reflexology treatment? So the treatment itself, it's a very soothing technique that uses gentle sweeping movements. I perform the protocol 2 times, one on one foot and then once on the other foot. And this creates a pump that forces the lymph to move out of the body. So once applied, this technique can be used for other benefits, such as arthritis, chronic fatigue, sinus problems, muscular tension, PMS, asthma, fibromyalgia, migraines, aches and pains, eczema, jet lag, headaches, and seasonal allergies. So what do people say after a treatment? So clients have noticed differences right away or can feel the benefits in a very short period of time. Most can also breathe better. They may be able to make a fist, wear a watch, wear their wedding rings again, perhaps not wear their compression sleeves anymore. But there's many, many benefits of this wonderful protocol. So I have loved learning this technique and consider it to be a really useful addition to my therapy toolkit. Thanks for listening.